3:30 p.m. on Wednesday, April 15th, 2020. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. Today we have 5 speakers, including Nita, Ludwig, the Administrator of the Rock Island County Health Department, Ed Rivers, the Director of the Scott County Health Department, Lori Elam, CEO of the Eastern Iowa Mental Health and Disability Services Region, Deputy Mike Mendoza of the Rock Island County Sheriff's Department, Dave Donovan, Director of the Scott County Emergency Management Agency. We ask that you direct your questions to the person you are addressing in the chat box, and the question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off with reporting Rock Island County's numbers. Thank you.
Sure. For today, Rock Island County Health Department is reporting 20 new cases of COVID-19. All of those, except one, are isolating at home today, and 12 patients are currently hospitalized overall. So our total cases are now at 180, with 12 of those currently hospitalized.
In Scott County today, we add 5 cases for a total of 129. And with these numbers, some in our community may feel that we're currently in a lull with respect to COVID-19, and there hasn't been a major change in guidance handed down from either of our states. And we've all settled into our new temporary normal of staying at home, limiting our time out and about, and remaining social with our family or friends from afar or virtually. However, we are not in a lull, and now is not the time to get complacent. The models out of Washington State indicate that the peak or the highest point of our infections will not appear until early May. This is in Scott County. That means that we have not come out the other side of this pandemic yet, because COVID-19 symptoms take up to 14 days to appear after someone's been exposed. What we're doing today will not impact our community until perhaps the end of the month. What we do now will affect the length of time this disease continues to spread in our community. So we must use the tools that each of us have to control how we respond by staying at home as much as possible, staying 6 feet necessary to be in public locations like grocery stores and pharmacies, and when outdoors. If you must go to the grocery stores, don't take the whole family. Send one of you to get the groceries and get back home. Don't gather in groups, especially with individuals from different households. This increases the risk of exposure. Clean and sanitize high-touch areas of your home and workplace, and wash your hands, and wash your hands. As a community, we don't want to look back on this event years from now and realize that we didn't do all we could to protect ourselves and our neighbors. We can do this.
Thank you, Ed. We will now hear from Lori Elam with the Eastern Iowa Mental Health and Disability Services Region. Go ahead, Lori.
Hey, well, thank you. Our region has developed a great crisis system, continuation of care, continuum of care, everything from the 24-hour hotline, mobile crisis, peer respite, drop-in centers, crisis stabilization beds, telehealth in all of our hospitals, and care coordinators. I just want to make sure that everybody knows that it's okay to ask for help, and the crisis services are still here. We're just changing how they are provided temporarily. The crisis care services are still available through the use of telephone, video conferencing, Snapchat, those type of things. You know, it's important that we all know that with a crisis, it's different for every person. And, you know, what's happening in our world right now is, you know, very different. Most of us have never experienced this before, and you may need some help. Isolating can result in depression. Folks are unemployed or temporarily laid off. The fear of the unknown of when this is going to end and what's going to happen to my job and what happens if my family member gets sick and dies. And there's just so many scary things out there. But I just want to stress again that we are here, we have services, and there are folks who can help and, provide just, a voice, someone to listen to. They can direct you to a specific provider if you needed help. We are just accessing services a little bit different, but we are here for folks, and we know that we'll start seeing more folks accessing services the longer the pandemic goes.
Thank you very much, Lori. Now we'll hear from Deputy Mike Mendoza with the Rock Island County Sheriff's Department. Go ahead, Mike.
Thank you. We have received a total of 7 shipments from the state, and the first shipment we received was on March 20th, and as of yesterday's date, we received our 7th shipment. The shipments have varied in size. IDOT picks up the shipments and delivers the PPE items to the designated delivery sites. The state reaches out to us when a shipment is en route. That's the only way we know when a shipment is coming. So far, the Rock Island County has provided PPEs to 33 different organizations within our county, which consist of, but not limited to, hospitals, long-term care facilities, the Rock Island County Health Department, acute care facilities, police, corrections, fire, EMS, transportation, and public works. We have also issued cloth masks to all deputy sheriffs, all correctional officers, all inmates in the Rock Island County Jail, and other police departments, as well as our health department employees. We have received all cloth masks as donations from several individuals and foundations from the local area. If anyone wants to donate cloth masks, we would greatly appreciate them. The number to call is 309-799-7986. Thank you.
Thank you, Deputy Mendoza. Next, we'll hear from Dave Donovan with the Scott County Emergency Management Agency.
Good afternoon, everyone. Regarding personal protective equipment for Scott County, Scott County EMA does have 2 county employees that are working almost exclusively on personal protective equipment out of the EMA office. We also have a Bettendorf firefighter who's working a good portion of his time in this effort, and he's acting as our resource and logistics lead. PPE and logistics pretty much every day. We're currently fulfilling PPE requests for two sort of distinct groups, healthcare, and that is primarily long-term care, although there are other facilities in there as well, including some clinics, and our 2 hospital systems as well. And then the second group primarily is our first responders, and that's emergency medical, fire, law enforcement. We have issued masks to all of our law enforcement personnel. All of our firefighters and our EMS personnel have masks and the personal protective equipment that they need to be able to do their jobs effectively and to protect themselves as well as the patients that they're treating. At this time. Most of what we're supplying thus far has been hand sanitizer, disinfecting wipes, nitrile gloves, surgical masks, cloth masks, the N95 masks that we hear so much about, isolation gowns, face shields, and other eye protection. Our biggest issue thus far has been getting those isolation gowns. They seem to be in the shortest supply of all of the PPE. We are also getting distributions from the state of Iowa. We've had 3 total thus far, and those distributions do tend to be a percentage, typically less than half of for most items of what we're requesting. And we understand that is because there are shortages of some of the PPE nationwide, and so the state's not able to fill at 100% of what we're requesting. We do continue to work with our suppliers and the county's purchasing agents to help fill that gap between the request and what's provided through the state of Iowa. Thus far, we're meeting most of the needs at this time. That may change as the duration of the need and the event continues. Thank you.
Thank you very much to all of the speakers who are on today. We will now go to the questions that are coming in through the chat. Please type them in as they come. The first question is for Lori.
Brooke,
How are the mental
I'm
health
sorry.
service? Oh,
Brooke.
my gosh, Nita, you need to still talk. I apologize. Please go ahead.
That's okay. So this is Nita from Rock Island County Health Department, and we wanted to touch just a little bit on how long will this go on. We in public health do not have the authority to decide that. In our federal constitution republic, those powers are reserved for governors of the states. In the Quad Cities, we get a unique view of how there is not a uniform set of national guidelines. Illinoisans live under a stay-at-home order from Governor J.B. Pritzker, but Iowa Governor Kim Reynolds has not issued a similar mandate. Our message locally has been clear for weeks: stay at home. Despite all the personal and economic pain of COVID-19, this week, World Health Organization officials say in most places around the globe, now is too soon to get back to normal. Jumping the gun could trigger new peaks of COVID-19. The process must be slow, deliberate, and coordinated. Any government that wants to start lifting restrictions, WHO officials said, should look closely at the following conditions: the disease transmission being under control, and the health systems need to be able to detect, test, isolate, and treat every case and trace every contact. Hotspot risks need to be minimized in vulnerable places such as nursing homes. Schools, workplaces, and other essential places have to have those established preventative measures, and the risk of importing new cases has to be managed, and communities need to be fully educated, engaged, and empowered to live under this new normal. We likely have not met all those criteria. The number of new cases continues to rise sharply in the U.S., in Illinois and Iowa. We are seeing signs that restrictive measures are starting to flatten the curve, though. But we must note that flattening the curve only means the rapid rise might have ended. We could still be at this level peak for some time. We don't know how long, but we do know that people are doing their part by staying home, and that could lead to a drop in the number of cases here. We just finished a weekend of religious and cultural celebrations important to many Quad Cityans. Some of you may have attended extended family gatherings. We could see another peak of infections if that were the case as a result. While decision makers at the state level will be trusted to make these decisions for our community, the reality is that you have the power. We have the power. Use it wisely and stay home as much as possible.
Thank you, Nita, and thank you for letting me know that you still had some talking points. So I apologize again. Now we will go to the chat. We will start with the first question, and that is for Lori. How are mental health services in Scott County and are the surrounding areas doing? Are they busy and getting lots of calls or more cases?
Okay, good questions. I have the March data. This is middle of April. I won't have April data until the first week in May. March data was very similar to previous months, in which, you know, we were still doing face-to-face contacts for probably half of March. And we still had the same number of evaluations done through telehealth in the emergency rooms. The mobile crisis calls were still very popular and folks going out to see people. Our April numbers, I would imagine, may be lower initially as people become more comfortable with talking to somebody on the phone or through video conferencing. And we've got some great mental health professionals, both with the hotline and the mobile crisis, that are able to engage people over the phone and help them work through things. But we always tell people, if, you know, if they are thinking about self-harm or they're thinking about hurting others, if they need to go to the hospital, they think they need that level of care, we want them to call 911 and we want them to get the care they need.
Thank you very much. Nita, we have another question for you. The state just released numbers too, including a death of one male in his 50s of Rock Island County. Can you confirm this since it's been put out by the state?
Yes, that was actually the death that we reported on Monday. I believe the person passed away on Sunday, and the state is just kind of, there's just a little delay in the reporting from the state numbers, but that is the person that passed away this weekend.
Thank you. Next question, are Scott County Jail personnel wearing masks, and are masks being worn by inmates? We would encourage you to contact the Scott County Jail for some of that information, so that would be best responded to by them. We have a question here. Nita, I know yesterday you said you weren't aware of any hotspots in the county. We have received many concerned emails and calls from Tyson and Jocelyn, with the Tyson plant in Columbus Junction having 148 cases. Is your health department keeping an eye on the Jocelyn plant? And has anyone gone out there to see how they're doing?
Yes, so Rock Island County and the Illinois Department of Public Health does not provide names of facilities, but can provide aggregate data. And we have been in contact with lots of our large businesses in Rock Island County, and they are all doing a really good job of mitigation strategies. We have been in contact. We do have environmental health sanitarians that do touch base with them on a regular basis.
Thank you. Another question for Lori. Do you have a sense of how many people living in group homes are doing? What extra restrictions do they have to deal with?
Yeah, I serve as guardian for a handful of folks who are living in group homes or in houses with 2 and 3 other roommates. And I know that the local providers have canceled any activities out in the community. They don't take, larger groups to grocery stores. They're not going to movies. They're not going out to eat, obviously, with a lot of places shut down. They are staying inside. They may go outside for a walk, but it's one staff person and one individual, and they try to make sure that they're maintaining that 6-foot distance. They're also doing that in the home. They'll have somebody sit on the couch and maybe somebody sit at the dining room table and bring in another chair. They're trying to be as creative as they can and explain to the individuals they're working with the importance of personal space and covering your mouth and nose when you're coughing or sneezing, and good hand washing. All of the individuals that I serve as guardian for have maintained their sense of humor through all of this. It's been very trying to have to stay home and not be able to go out and do some fun things, and they sometimes have limited cognitive ability to understand, and so they've done very well. We've got some individuals who are learning new crafts now and making some things and doing some painting, and staff are being very creative, keeping folks busy. So I have to commend all of our local providers for that.
Thank you, Lori. We'll give another 30 seconds. Please post any additional questions that you have. Okay, we don't have any additional questions. WVIK would encourage you to reach out to Lori with the mental health region for some additional information if you'd like to hear some of the stories she has to share. Again, thank you all for joining us today. We're very appreciative of your time and getting this information out to our community, as this is the best way that we can work together to help minimize the spread of COVID-19. We look forward to talking with you again later this week, so please be watching for additional information from us. Thank you and have a nice day.